In Kansas, we have a dental access issue. It's very difficult to attract dentists out into these rural areas where we live.
The reality we confront today is that too many of our citizens do not have access to dental care.
Dental health care in Indian country has been a struggle for the last 100 years.
Here we have an opportunity to solve a problem, to expand the workforce and provide people to meet the needs of vulnerable children. And we need to be doing this all over this country.
Hello, everybody. Would you like to learn how to have strong, healthy teeth?
The Kellogg Foundation has a very long history in working to expand the scope of practice and access to dental care. More than a dozen states are now investigating practice models like licensed dental practitioners or dental therapists that could provide a lot more care in a lot more cost-affordable manner to a lot more people.
I have 3 children, a 16-year-old, 14-year-old, and a 5-year-old. Access to care in the immediate community is not available. We travel about 105 miles to get to our dentist.
More than 50 million Americans in this country lack easy access to affordable dental care.
We have many counties that don't even have a dentist. We have a lot of counties that have very few dentists. And for the population that I serve that has the health wave or Medicaid type of insurance, we have very few dental providers that are willing to accept those patients. I was invited to go up to Alaska and visit the dental therapy school that they had up there. And I was very impressed with the way that they were able to handle their patients, the trust that their patients had in them, and the quality of their work was exactly what I would have expected from a dentist. It's the same.
People often ask, why did you start this program? And it was simply because tribal leaders got tired of seeing kids graduate from high school with full sets of dentures.
I'm part of the village, and just to know that they're well taken care of oral health wise, it just gives me comfort knowing that I'm doing all I can to help them.
I think that in Kansas, much like they have in Alaska, a dental practitioner or dental therapist would free up the dentist, since there aren't as many of us, so that we could be doing the more complex things. It's very much a team approach. Dentistry has that already. We have assistants, we have hygienists, and if we had some sort of a practitioner that could work with the dentist to fill in that huge gap between what the hygienist can do and what the dentist can do, we would be a better team.
Every study that's ever been done on dental therapists shows that within their limited scope of practice, they do things just as well as dentists.
These practitioners who are well trained and well practiced, they develop a viable career. So it's also an economic development strategy that's important in communities that need economic development strategies, that need more jobs and more opportunities for employment.
This program was our local solution to our local problem. But guess what? You have these same issues in your communities, and our local solution could also be used as your local solution.
Our approach to health in terms of the Kellogg Foundation has always been to listen to community and to create, if you will, avenues for communities to have voice in finding solutions.
We were very interested in serving our community in Washington Heights and Harlem with dental care, especially for children. And their need for oral health care was enormous. We wanted to do this as a collaborative program with the community. So we engaged community groups, and it built up a trust that we didn't have prior to that with community groups. So we developed what we call the Community Dent Care Network, where we set up programs in schools, plus a dental van to reach the Head Start population.
We would need 10,000 more dentists just to reach the need and the care that's not being provided now. And we're just not in a position to do that.
I know I'm committed to service, and I wish more people will find a way to commit themselves to service too.
We applaud dentists who have a sense of humanity and step up and provide volunteer care, but we can't volunteer our way out of this national crisis. We have to have structural solutions, solutions that expand the workforce, solutions that address the cost dynamics in a thoughtful way, solutions that empower communities and that are sustainable. And we believe the dental therapist model is just such a solution.
I think after people work with a dental therapist and see the quality of the work they can do and that it's safe, they become proponents. And Alaska has shown us that maybe as a profession, we needed to take another look at dental therapists and how we could use them to help reach out into communities where there's a great deal of need.
We know it can work. Now it's just a question of finding its traction in community groups, and more people are telling us they are really excited about a mid-level provider, a licensed dental practitioner, a dental therapist that can really expand access to care.
I believe there is a serious quiet crisis that is occurring in Indian country when it comes to dental health care for tribal members. Here at Swinomish, we are very fortunate to have a dental clinic and a dentist on staff. When I was made aware of the statistics on the number of patients that we see and the number of patients that we need to be seeing, it was really eye-opening for me to see that this dental therapist program is something that we not only need here at Swinomish, but here in the Northwest. We're not reinventing the wheel. This is something that has been proven around the world. I would definitely have no problem having the therapist being there taking care of my dental needs.
I imagine sending my dental hygienist that I have worked with for years and whom I trust and work very well with back to school to get her dental practitioner degree. She is from a town that the entire county does not have a dentist, which is also neighboring another county that does not have a dentist. Our dream for minor family dentistry is to be able to have outreach clinics in those areas for the preventive side of dentistry so that we don't see the terrible things that we see now. And that's the key to better oral health, is prevention. So it's the perfect solution.
This is a very exciting time for those who are advocates for children's health, especially oral health. We really think this could be a breakthrough moment that would really advance the life course of all of our vulnerable kids. And we're excited with our partners because we think this is a winnable campaign that is going to make a difference for kids.
I'm a proponent of this program of dental therapists because we have a health problem in our country that's not being solved by the system as we have it now. We have a system that is very costly, that's inefficient, and that is not delivering services to people who need them.
I think there will come a time in the future when people look back and they think, wow, why didn't we do this sooner? Having a dental practitioner work in a team environment with the dentist is a win-win situation for everyone. I think it's going to be the answer to a lot of our access problems.